I was born in Malaysia, Singapore, and that's an industry place just like Houston. So I tend to choose chemistry and engineering as my career.
Well, I didn't really choose because I'm a Beng's follower. He came to Texas, I came to Texas. My training was in biochemistry. So when I come here, I just use biochemistry as a tool to apply to anti-cancer research.
My challenges in my career is you have to facing a whole bunch of Americans here. And they are all good scientists. Luckily enough, I have a very good mentor. And he is a well-known, the world's well-known medicinal chemist. And he makes lots of compounds and for anti-cancer agent. And luckily enough, I make at least 5 compounds a year. So I will impress him a lot.
Very good.
Yeah. My greatest accomplishment is I'm able to use 2 or 3 fields to, for example, biochemistry, pharmacology, and organic chemistry.
The only challenge that I encountered is because I'm a woman and I am short in height. So, and also I'm a Chinese.
Okay.
So I found that I have to stand where I am. If I can do my job good, people respect me, that challenge is gone.
Well, I served as a volunteer for about 10 years before I served in the Chinese community APEC, at the APEC, or Area Agency on Aging Advisory Council. So I served a long time in there. And so I know how to become a volunteer. And then so from then on, I become a volunteer of the society and later on Chinese society.
I think the Chinese is they don't work together, 1. And 2, like the people, they don't go to see the doctors if not sick. And another thing is the mental illness. The Chinese do not think that's a disease. So they want to keep it secret. So that's very hard for doctors to care for them. And also, many people come from rural area in China or immigrants, they don't have insurance. So when Beng, many years ago now, I think for 25 years, they have an annual health fair. It's free. They set up many stations, people. Almost 1,000 people come to Chinese Culture Center because it's free. But since they don't have insurance, so this is the only time they can do it. But it takes a lot of manpower, time, so slowly they have every like a pathology, sugar, and every station they have covered this test.
I think our Chinese try very hard to get things done as far as get together and plan together and to get funding for the health. However, I think the collaboration with the other ethnic group, like non-Chinese, American group, is not as strong as what I think. So I think we should take because advantage of this environment in Houston, especially medical center, and then form a very strong health group for Chinese.
Well, I was born and raised in Taiwan. My parents fled China after the communists took over China. I think I have to contribute a lot to my mother. You know, my mother is a real smart woman. She's really smart. She was the top of her class in her school, but she couldn't go to high school because during that time, Japanese invaded China. And so she always told me, just get your education, go as high as you can. And because I used to want to learn how to cook, she does so many things so well. And she said, don't worry about it. These things are easy. Housework is easy. You study. And so I knew I wanted a higher degree. And I knew that I enjoyed teaching. So it just led me to, a PhD in biology and then a career in cancer research and teaching. Yeah, I was a tenured associate professor. Yeah, I went to Anderson right after PhD. So I did my postdoc at Anderson. And that's where I met my husband, Gary. Since my father died from lung cancer in 1983, I've been the primary caretaker for my mom. And to balance work and taking care of my mom was a challenge. In the beginning, not so much because she helped me a lot at home. She cooked for me. But then later on, she started to have some memory problems. And a few times when I was at work, I got phone calls from strangers saying that, I have your mom here. She apparently took a walk and couldn't find home. And so I eventually made the decision to retire early because I want to be able to take care of my mom. And finally, Dr. Lovell Jones, he offered me a position at the Center for Research on Minority Health. Really gave me an opportunity to work with the community, which I really hadn't had the opportunity to do. And it was during that time that I started to volunteer with the American Cancer Society, started going to the cancer support groups in the Chinese community, and I learned so much from them, from the cancer patients, and that's also when I started the Asian Cancer Council. I think, thinking about my father, he had lung cancer. He was diagnosed in Taiwan, and then we flew him here for treatment in Dallas. But all throughout his illness, he did not want to acknowledge that he had cancer. He always referred to his lung cancer as, oh, my spot, that's. And I think he was so typical of Asians who just did not want to talk about cancer. And also with a lot of Asians in Houston, they couldn't, read the English literature. They had, no access to cancer information. So I thought it would be good to provide some Asian language cancer information, to conduct some workshops, talks in Asian languages, and to provide cancer support, to really talk to them when they needed help. So it was those reasons that I thought I would like to start something. Even at that time, Asian ACS, they wanted to reach out to the Asian community and they didn't know how. So, and they want to partner with MD Anderson. And so when they asked me, I said, yes, yeah, absolutely. I really think that the people had a lot more awareness to cancer prevention. They have more knowledge. They have now literature in their own languages they could read. And they have cancer support groups to go to. So I really think, and there are so many health fairs, workshops, we get more and more people involved. I think people are more likely to talk about their cancer now.